Hello, my name is Luis, and today I'm going to be showing you guys how to do some skull X-rays. We're going to do four different projections. You want to have your tube set up 40 inches from the bucky, and we're going to be using 10 by 12 cassettes today for our images. So once your room is set up and ready, you're ready to get your patient. Joseph?
Hello.
Hey, how's it going, Joseph? How are you doing today?
Good.
What's going on? What's the reason for your visit today, sir?
I fell last night, got a little crazy. I hit my head.
Oh, okay.
Yeah.
All right, we're gonna be doing some skull X-rays, okay?
Okay.
So we're gonna start off. Can I get your first and last name?
Joseph Rivera.
And then birth date.
1/29/93.
Always double ID your patients. Check their ID. Okay. Perfect. And if this was a female, I would ask for possibility of pregnancy. So there's no possibility of pregnancy. Right?
No, there's not.
All right. Perfect. All right. So now we can start the exam. First of all, you want to make sure that your patient doesn't have any earrings, nose rings, tongue rings, nothing metal in the face. Okay. So now I'm gonna have you go ahead and sit, and I'm gonna have you face the board. Okay, for our first image. Perfect. Okay. I'm gonna have you touch your nose and your forehead to the IR there, just like that. Good. You want to have your OML perpendicular to the IR, just like that. Your central ray is going to exit at the nasion. So you want to have a 15-degree angle on your tube. For the Caldwell method, this is your Caldwell method. Your PA axial. So you're going to have your central ray exit at the nasion, just like that. Align your bucky. Bring the bucky up, okay? Just like that. You want to put your left marker on the correct side, so on your left side. Just like that, and then collimate. Collimate accordingly, just like that. And then for your PA axial Caldwell, you want to use technique 85 kVp at about 12 to 14 mass. So once your patient is ready and positioned, shield your patient, and you're ready to expose your patient. So, okay, Joseph, don't move, okay? Hold still, X-ray, and go ahead and relax. Good. So once you shoot your Caldwell, your PA axial, you want to go and do your towns. So you're going to turn your patient around. And you turn around. The back of your head on the board now. Good, just like that. Make sure you're centered. So for your PA or for your AP axial, you're gonna do a Towns method. So this one is 30-degree angle, caught angle, 30 degrees, and then you're gonna have your patient put their chin as close to their chest as they can, just like that. You want to have your OML perpendicular to the IR once again. So once you have your 30-degree tube angle, you want to center 2.5 inches above the glabella, which is right about there. Slide over here, but not just right there. That's perfect, just like that. Right about there. You want to line up your bucky. Here, just like that. If your patient is unable to bring their chin down enough, if they're aligned at the IOML, if their IOML is perpendicular, you want to do a 37-degree angle, a little more angle. You want to put your marker, the right marker on the right side. You want to collimate. You want to collimate to include the whole cranium. Just like that. You always want to shield your patient. How you doing, Joseph? Okay. All right. Okay. For your Towns method, you're going to use a similar technique, 85 kVp at 12 to 14 mass. And once your patient is ready for exposure, you can now. Okay, so hold still, Joseph. Shooting X-ray. X-ray. Okay, go ahead and relax. How you doing? Doing okay? Okay. So now after your Towns method, after the AP axial, you're gonna shoot a lateral. So I'm gonna have you face the wall, okay? So stand straight and kind of have your body under the bucky. So kind of slide in a little bit more, just like that. Perfect. All right. So for this, for your lateral, you don't need a tube angle. So you're gonna go back to 90 degrees. And you're gonna shoot straight on. Okay. And have you center. So put your gear hole right at the middle of the. There you go, just like that. Perfect. Just like that. Down, you want to have the IOML or the OML perpendicular with the edge of the IR here. Just like that. You want to have the mid-sagittal plane perpendicular with the IR. And then you want to have the interpupillary line perpendicular with the IR. Make sure you're not rotated. Just like that. Open up collimation, make sure you get the whole skull in there. Align your bucky. The right side is down, so you want to put a right marker. Or your left side's down, sorry. Left side's down, so you're going to put your left marker. Just like that. Shield your patient. You okay, Joseph? Alright, so once your patient is set up and now you're ready to expose for lateral, you're going to want to use a much lighter technique. You're going to use 85 kVp at about 6 mass. So you're ready to expose. Alright, hold still, Joseph. X-ray. Alright, go ahead and relax. And then for our last image, we're going to shoot a SMV, which is a subventral vertical projection. So now I'm going to have you face the board here. And then I'm going to have you put your chin up as high as you can, just like that. You want to have the IOML parallel with the IR. Give a little less rotation, okay? Right there. Perfect, just like that. And then you want your central ray is going to go in. You also want no tube angle for this, and your central ray is going to go in between the mandibular angles, 3/4 of an inch above the EAM, which is right about here. Right about where I have it there. I'm going to slide you over to your left this one right there. Perfect, just like that. You want to align your bucky. Okay, just like that. Alright. You want to collimate. Alright. Right marker for the right side. Shield your patient. How you doing, Justin? Okay, good? Alright. Just like that. Okay, and then for the SMV, you want to have a technique of 85 at 28 mass. A little higher, you're going through more density. So once your patient is lined up and positioned, you're ready to expose. Hold still, Josu. X-ray. And once go ahead and relax. Sorry about that. So once you shoot your SMV, you are finished with the exam, and we're going to send those images out to the doctor. He'll be with you shortly, okay?
All right. Thank you very much.
Feel better, of course. Thank you. So once you have finished shooting your skull x-rays, you can now evaluate your images. So we started with the PA axial Caldwell method. And this one we angled 15 degrees caudad. And we wanted OML perpendicular with the IR. So for this one, you want the petrous ridges on the lower third of the orbits here. So right about there. It's a good image there. You want to make sure there's no rotation of the skull. We shot this image 85 kVp at 12 to 14 mass. So once we shot that one, we want to do our Towns method, our AP axial. For your AP axial, you want to visualize the dorsum sella within the foramen magnum. Right in this area right there, you want to, your petrous ridges should be symmetrical, making a V shape, just like that. It's a good image. Right marker for the right side. You want to make sure there's no rotation as well. Mandibles are pretty symmetrical there. We shot this one 85 at Same technique, 85 kVp at 12 to 14 mass. And then we went on to shoot our lateral scope. We had the left side down, which is why the left marker is here. So for the left lateral skull, you want to make sure the entire skull is in the image. You want to make sure there's no rotation. And I forgot to mention that you want to center 2 inches above the EAM, the external auditory meatus. And make sure the entire skull is there, just like that. Good image. And we shot this one 85 kV at 6 mass. So we went on to shoot our last image, the SMV, which is this one here. For this one, you want to make sure there's no rotation as well. You can tell it's a little rotated because the zygomatic arches here. This one's a little bigger, so it's a little rotated, but not enough to repeat. You want to make sure your mandibular condyles are anterior to the petrous ridges here, which they are. There's enough rotation there, so that's good. Right marker on the right side. The technique we shot to shoot this one I mentioned was 85 kVp at 28 mass.